My name is Anissa Buchanan. I'm a senior clinic administrator at Family Medicine at East Des Moines and La Clinica de la Esperanza. So in the beginning of COVID, there was a lot of fear, even on the clinic side. A lot of uncertainty. We didn't know if we would be safe or how safe we would be, especially in the very beginning days. We were unlike a lot of other clinics because we stayed fairly busy the whole time. We had probably about a week to 10-day lull, and then our patients were still coming in. A lot of it was due to the language barrier some of our patients have. Some of them also, I don't think, understood the severity of COVID. So we had to manage how to keep our staff safe, but also how to take care of our patients. So it was very fearful and very stressful the first few months. We increased our daily huddles from once in the morning to twice a day. We met weekly as a clinic staff and a resident faculty to make sure we had all the up-to-date information sent out. And we tried to formulate strategies to take really good care of our patients. We kind of got used to things, so as things went on, we kept wearing masks, kept wearing our face shields, kept keeping ourselves safe, had our patients still coming in, and we did fairly well with keeping our staff safe. And then we became a vaccine hub. So we have administered a ton of vaccines to our community. We began January 2nd of 2021. We started out doing just weekends. We would do 330 shots a day on Saturdays and Sundays. And now we also do them in the evenings. We stopped weekends a month ago. Now we do evenings from 5:30 to 7:30, and we do about 100 vaccines an evening. We did that mainly so that we could support our patients that are in this community. A lot of them don't have a way to get to Urbandale or Ankeny to get a vaccine. So we wanted our Eastside Hub to stand up so that we could take care of our patients. I'm also on our Diversity, Equity, and Inclusion Subcommittee, and we developed a vaccine toolkit to address vaccine hesitancy with our minority populations. We've done a fairly good job. We're starting to slow down a little bit, but we've noticed that a lot of patients of every socioeconomic status, every ethnic culture, every language have come through our clinic to get their vaccines. So that makes us feel really good. We did take more of a personal approach. So we printed a list of all of our patients that were non-English speaking and that were 65 and older, and personally called each of them to get them to come in, and that way we could answer any questions that they had. And that was fairly successful. We do still see some vaccine hesitancy, but it does seem to be improving from when we first began giving vaccines. It's been a very tiring process. 2020 was very stressful, and so we focused a lot with my clinic staff on working together and giving each other breaks when we need it. And in 2021, that's kind of carried over, just some self-care to make sure everyone's okay all the time. The vaccine clinics have required a lot of hours of work, but it's been very rewarding work. My staff has chipped in like none other to help to make sure our community gets vaccinated. And I just can't thank them enough. I'm also thankful that our community trusts us enough to come here and get vaccinated. So the staff here at the clinic, they work their normal 8:30 to 5, and then quite a few of them will stay over until 7:30 to help us give vaccines in the evenings. So they're working a lot of overtime hours and putting in the care just to make sure our patients are taken care of. They don't really ask for anything in return. I do feed them on the weekends, but they've done an excellent job, and I haven't really had to reach out to have others help. The core staff here has done a really good job of taking care of our patients. Some of the most common misconceptions about the vaccine I've noticed amongst the minority community, and I'm going to use the Black community because I'm Black. A lot of them think that, you may be implanting a microchip into their body with the vaccine, or that they're being experimented on by the government. So a lot of times you just have to reassure people that that's not the case. I mean, they're not implanting any microchips. Your cell phone's the biggest microchip you have if they want to track you. But I think by doctors and healthcare workers being the first line to receive the vaccine and then showing people by example, it has made them much more comfortable to get the vaccine. I know here in our clinic we have a very diverse employee population, and in the beginning we had a very hard time getting some of our minority employees vaccinated. But once they began to see the physicians and the residents and the leadership getting vaccinated, they decided it was okay for them as well. There's just a lot of things that go into it. You just have to make sure people are comfortable with it, and that they know that there's no long-term adverse effects with this. We're just trying to eradicate the virus.